how is the situation here and how we cope with it. So after explaining to some of you what we are doing, and it's fairly complex in a way, so I was asked and suggested to present our strategy for all the people of the Angle Society that are interested. So that's the reason why I felt a little bit uncomfortable at the beginning, because I'm not an expert on infection and I do not want to talk about that. I simply try to explain how we organize the situation in the last 3 weeks. This, I think it could be very useful, especially for those of you that are now in the same situation that we were 3 weeks ago. So now the title of presentation is similar to the one that I gave to the network of 85 offices that we have in our association throughout Italy. And all of them implement some of the things that I'm explaining to you. And so far, they have done it quite effectively and successfully. So that's the reason why we are now, I'm trying to share what I put together. So the first consideration, we are facing a crisis. And so the crisis is basically a moment to select, discern, and decide. So that is the very first consideration. Everything started on the 22nd of February. You can see a small area close to Milan, in the area of Lodi and Casal Pusterlengo. Parma is about 60 kilometers south of this area, where the first infected patient got recognized. Now, we don't really know how it started. Patient 0 was never identified. There was some consideration about the fact that Webasto, that is a German manufacturer, has a big factory also in the same area. So, but there is no consideration and we don't know exactly what was the main reason why everything started. Anyhow, at that time, we are talking about 22nd of February, a little more than 3 weeks ago, everything started and we got the news on the papers. I was in San Sebastian and I flew back on the same day, on Saturday, to Parma. And I started to work on the plan of the office the same Sunday. And you can see the timeline. So we are talking about 3 weeks and the actions that we took in the last 3 weeks, so that you have a perspective of how quick could be the evolution of the process. On the right side, you can see the situation at today. So the red area is fairly big in the northern part of Italy. And I have to add that northern part of Italy has probably the best infrastructure in terms of healthcare in the country, and certainly is comparable to any other area in Europe. So in a way, it was very unfortunate it happened close to Parma, but on the other side, I have to say that is the part of the country that can probably face such a huge crisis in the best possible way. Anyhow, we had to decide. And so it was Sunday when we had to decide which direction to take, to decide where are we. And at that time, we were still in the yellow zone. So basically, Parma had only 2 people infected coming from the red zone, but nothing more than that. And so it was just a concern, but it was not anything major at that time. And I was trying to understand with my staff, where do we want to be in 8 weeks? Why 8 weeks? Because I was thinking that very unlikely such a thing could finish in less than 2 months. So since we cannot have long-term plan, I was trying to evaluate how to arrange everything in the short term. And short term for us is at least 8 weeks, 2 months. And what type of reaction we could put together. And of course, I will suggest be very flexible, because what we went through was changing almost day by day. So your decision has to be always fine-tuned according to what is going on in your area. And there is the need of taking new decisions within the practice. So on Sunday, I set 3 webinars on Skype with all the staff. I wanted all the staff on the same page and fine-tune, also because I could not do anything without them. So it is extremely important to get the staff aligned with what are your goals and plan. They are part of the strategy. And so we created also a WhatsApp group with the staff, so we can communicate in real time throughout the Sunday. And I explained what were my order of priorities, so they were clear about what we wanted to accomplish. First point is safety of staff and patients. Your staff could be very uncomfortable if they feel that they work in an unsafe place. So I have to make sure that they felt safe, and safety of staff and patient was the first consideration without any other aspect. The second consideration after that was proper patient care, despite the crisis that it was mounting. And the third is office organization and economics, because of course, this is a very important factors to take into account. And so in terms of hierarchy of decision, safety was first. And safety of patient means that we had to reduce, according to the guidelines of the health authorities, to significantly reduce the workflow of patients. And think that on Thursday, when I left to San Sebastian, the office was running full speed. And on Monday, we had 85 patients scheduled, Monday through Wednesday. And so we immediately decided to bring down the workflow to 30 appointments. Keeping in mind the timeline. On Sunday, the 23rd of February, in Parma, we had only 2 or 3 cases coming from the red zone, no more than that. So we could not expect anything more. And so, but anyhow, we reduced the workflow immediately. I do not want to waste time or your time to explain how all the patient went through a triage in terms of action when the patient gets into the office. If anybody is interested, I can explain in more details, but you probably already have guidelines from your dental association or health authorities. What I'm talking about is how to reorganize the office. So the reduction to 30 came from the decision to create 3 safe areas in the office that could be easily and perfectly disinfected, and with a very reduced amount of people working in contact with patients. And of course, one of the major issues at that time was the availability of proper gears for doctors and staff. I will go back to it. And so we decided, our office has 8 chairs and 2 scanners. So we made 3 safe chairs for patients where we could limit the amount of workflow. The flow is essential and requires lots of work. So the significant reduction of workflow meant that 3 staff members on Sunday made a triage of all the appointments. We are not talking about the triage of the health condition of the patient. That, of course, was extremely important, and we did that. but it's the triage of the type of appointments, what type of procedures they need to go through. And so we divided the patient in active patient that could not be postponed, active patient that could be postponed, and controls that could be mostly postponed. Why is that? Because after dividing the appointments, and we decided that on Sunday and Monday morning, we should be able to change the appointment up to Wednesday. That means around 250 appointments. Then we had to know exactly what to say to them. And so at that point, 2 staff members worked on 2 types of SMS. So the first contact with the patient was through SMS. So active patient that could not be postponed. This active patient that could not be postponed received an SMS with instructions how to get accepted in the office. So of course, the SMS cannot be that long, but we made clear that we comply with the strict rules that were provided by the health authorities, and therefore under the strict rules, in order to get in the office, we had to change the normal policy. And since the waiting room was totally empty and many other things had to be done, we also make sure that all the patients that could come had a telephone triage for the health condition within the family, not just by them, but also within the family. So no seasonal symptoms in the last 2 weeks, nobody in the family with the same thing in the last 2 weeks, and of course, no contact in the red zone. At that time, it was very limited. So that was the triage that we did by telephone after sending an SMS. So we want to make sure they properly understood the policy of the office. And in the telephone, we explained what they were supposed to do. Only one accompanying person staying out of the office. They should come with, and they should go through the process of disinfection coming into the clinical part, 2 meters of distance for all the people working in the office, and so on and so forth. But those are factors that you probably already know, and so I don't want to repeat my things that are unnecessary. But basically, we wanted to have first an SMS and second, a direct phone call. The active patient that could be postponed and the controls had received a different SMS. The SMS said to them, and the 2 staff members were working on that, the appointment is postponed, and of course, for the reason that we comply and so on and so forth, you will be directly contacted by the office to reprogram your appointment. We try to avoid on Monday morning to get 100 patients calling at the same time. Excuse me. So we wanted to reduce these type of condition. And so they were aware that they would have been recontacted by the office to reprogram their appointments. So this was a second SMS, 2 different types of SMS. All staff members starting on Monday morning were involved. The one that were not involved on patients got involved directly in working on the phone. And believe me, they work. It was a huge amount of work. So without all the full staff, it would have been impossible to do it. Why? Because we had to reduce the numbers of appointments to 25, 30, and we have to reprogram 250 appointments. So all staff members have been instructed and involved in this big work. Of course, at the same time, we canceled oral hygienes and all the rotating instrumentation, handpieces, have not been used since, in order not to create the condition for transmission of the infection within the office. So that was done the first day, on Monday that was done. We are talking about 3 weeks from now. Then, one of the major problems was to get proper gears for doctors and staff working on patients. We had, of course, some of them, but on Monday and Tuesday, I worked in trying to get face mask, possibly FP2 and 3 or 3, only for the people in direct contact with the patient. So doctor working on patient and staff working on patient, not for the rest. For the rest, we used a normal surgical mask that we normally use every day, shields for everybody. And also I was very much concerned about the possibility that the virus could stay on clothes. And so I had the idea to call and order gears that are normally used by chemical workers. So they are as effective as the one that you see in the infective department, but of course you have to wear it completely, how like Silvia is showing. So basically the normal work on patient was done with this type of gears. And that was also very important for the staff to understand that we were doing everything to get them in a safe condition. So they were, very much happy to see that, and was an important aspect. And also, everybody was instructed. All the members of the staff had to respect the distances, especially when we were using face masks. They were being instructed not to touch the face mask or to touch the face, and to maintain face mask all the time while they were in the office. Disinfection policy was extremely strict, but I think everybody's doing the same. So we had basically two types of gears. The gears that you see in blue and the gears that you see in light blue. This last is just for the assistant that we were running around the office, and of course reception. So that was the situation at this point. The second point was proper patient care. Patient care means that active patients that could not be postponed have been received, rescheduled and received after a direct phone call. And those patients were either surgical patient with active cantilevers or active appliances, recently installed palatal TADs or other TADs. So patients that we didn't want that they could get into an emergency because, of course, they could not go to the dental clinic at the hospital. The hospital is extremely under pressure at this point. Also, we did that, and when we finished, we scheduled the next appointment in 10 weeks, explaining to them that this appointment will need to be confirmed, and giving them the type of retractors that I will be talking about in a few minutes. So it would have been a major mistake to give an appointment in 4 weeks, like a normal appointment, because then you have to redo the same work at that time if the office will be still closed. So we put the appointment in 10 weeks. I think one of the major goals that I had in mind is to make a workflow that allow the office to maintain proper scheduling working. Otherwise, it could become a chaos that would be very difficult to resolve at the time of reopening, maybe in a couple of months. So that is the aim of these steps. So those patients were done, and also we explained to them, do not worry, with this procedure that I'm going to explain, we can check you at any moment if there is any problem. We guarantee care for significant emergencies. Significant emergency does not mean a bracket that is popping off. It's something that can force you to otherwise to go to the hospital. So that is guaranteed by the staff. Second, active patient that could be postponed. We had 4 staff members making direct phone calls to fix 25 video checks per day. And that has to be properly organized in the scheduling of the office, because it requires a quite significant workflow, and you don't want one staff calling twice the same patient of stuff like that. So we decided the exact workflow, how it has to be defined. And so we are talking about the check of palatal expander, headgears, the layer mask, removable plates, alignment that was done with small but stable wires, elastic checks, patients that do not require operative procedures. Those patients could be postponed. So we said, okay, now we are going to provide appointments for 25 video checks per day. We are still in the first week, as you can see, it's Wednesday, February 26th. So that was after 3 days, we were able to reschedule everything and stay in that condition. And so after that, we started to do auto video checks. As I said, 4 staff members were full employed in organizing it. And when they were calling, they were explaining to the patient that we want to guarantee the maximum quality of care, maintaining the proper treatment with minimal risk. Second, we emphasize the fact that it's totally true that we do have full documentation of your treatment and full technical capability to carry on the treatment, even though there are limitations, significant limitation. Third, we encourage them to watch a tutorial video that we created in the first 2 days to better understand what we want from the patient. And you will see the video in a moment. We are creating a more sophisticated professional tutorial. It was supposed to be delivered in the last 4 days, but everything closed down. So we are now working on the project. And very critical question, what do you use? Are you familiar with WhatsApp, FaceTime, Skype, or Zoom? The person that is calling should immediately sign on the specific chart the exact cell number to call, because it's not necessarily the one that was recorded on the record of the patient. And also if we should use one of the 4 platforms that you see. So we need to know, should we call with WhatsApp, FaceTime, Skype, or Zoom? That was essential, otherwise it's a mess. You need to know it immediately. So that was recorded during the first direct call to the patient. Then we posted the tutorial in 2 positions. On the website of the office, on the bottom line, if you scroll, you will see blog, and there is the tutorial. Or you can go on YouTube, and if you go Studio Orthodontic Cocconi, and there is a specific video that says come indossare, how to wear the retractors for video checks, for video controllo. And basically on YouTube's, you see something like that. This is the retractors. This is the way they should wear it. We want to see a perpendicular, and we want to see different perspectives. Now, the first consideration is that the aim of this tutorial was mainly to make them understand what we're supposed to see in the video checks. Then I will give you more information. We decided to use this Optragate. This is just a retractor that are used normally by oral hygienists. It's easy and inexpensive. It's packed and sealed, and so they can open it and they can reuse it. They just rinse it and they can reuse it. And so this was the aim. Now, keep in mind that also some of these patients, let's say most of them, especially at the beginning, we are now Monday, March 2nd, so beginning of the second week, they didn't have the retractors. So I explain, if you are able to see me in the small area, we explain to use just the 4 fingers as retractors. They insert them and they diverge them so that they can use them as good as a retractor. Or 2 coffee spoons. But I would say fingers are the best after the normal retractors. And we are creating a tutorial to explain them how to use the fingers. Let me give you some tips after now 2 weeks of experience. The first tip is the smartphone, if you use WhatsApp, should be placed on a table, on a firm object. They should not keep it in their own hands. Both hands should be free. They should stay in a room with good lighting, but not in front of a window. If you have an excessive lighting, the camera of the smartphone most often get overexposed and you don't see much. But they just have to position themselves perpendicular, and you explain, look, you should try to let me see exactly what you see in the tutorial. That works pretty nicely and without significant problems. And of course, these auto checks, video checks, will be done directly by the doctor. The doctor knows the number and the time of the appointment. He connects. And so it's very easy to connect. And so the doctor will check the situation and will fill up the chart only. As you will see afterwards, the staff will call and make 2 appointments. So the doctor calls directly the patient from a cellular telephone of the office. Let me give you an important suggestion. We bought 2 extra cards, and we have now 4 cellular telephone with the number of the office. Not so, otherwise you are forced to use your private number. And so that could be a major problem. So just buy an expensive cellular telephone that has Android so that you can use WhatsApp without any problem. And so the doctor calls, not the assistant. The assistant already confirmed the appointment and doctor calls. Now, keep in mind that since 3 weeks, all the schools are closed. So most of the young patients are now following video lessons on their computer in the morning. So we have to take that into account. So cellular telephone are still very much useful, because then the mother can call the son or daughter and just interrupt them from the lesson for a few minutes, and then they go back. You don't want to invade their own computer in a way. So the doctor calls directly. And after that, it is very important, this aspect. We tried to use WhatsApp from our computer and it failed. It is much better to use the cellular telephone, because you can call them, but also reversing the telephone versus the screen of your computer, you can show them their situation and you can point your fingers and try to explain what they are supposed to do. And they understand completely what you're doing. After completing the video checks and the clinical chart, the staff independently will call to fix the next 2 appointments. Why 2 appointments? Because the first appointment will be a next video check that will be scheduled at 4 to 6 weeks. Why? Because it's very unlikely in our perspective that in 4 to 6 weeks our office will be running. So in that case, if you fix an appointment in the office, very likely you're going to change it. So we fixed another video check. Whereas the second appointment is scheduled in the office in 10 to 12 weeks. So we keep a, let's say, a safe distance of 2.5 months at least before we schedule a fixed appointment in the office, of course, with the premise that we do not know exactly and they will receive confirmation. But as I said, we try to maintain the schedule of patient in order without avoiding chaos in 2 months from now. So that is the policy of the office. So this is just a sequence. I am using WhatsApp and I'm showing the patient that is connected through WhatsApp exactly where we are and what they are supposed to do. This is done from the office. Now we do the same from our house since the office is closed. Now look, it is very important what I'm doing right now. I'm opening the picture of the patient and I'm explaining how to use the fingers as retractors so that they can understand exactly how we can see the situation.
Renato, sei uscito dallo screen sharing.
Cosa posso fare? Mi puoi rimettere?
Devi schiacciare sul verde. Dovresti trovare il verde screen share e riattivarlo. Perfetto.
Sono ancora su?
Sì.
Ok. Sorry for the inconvenience. Andrea, tu stai vedendo le loro chat?
Sì, la chat per ora è ferma.
Ok. Sorry, I made a mistake and I pressed the wrong appointment. So, in terms of WhatsApp, appointment confirmed, doctor called directly the patient from the cellular of the office. Use the cellular to show them the screen of your computer. it is extremely effective. After completing the video check and the clinical chart, the staff will call to fix the next 2 appointments. First video check, 4 to 6 weeks. Second, in-office appointment in 10 to 12 weeks. If you use Apple iPhone and the patient has FaceTime, then the auto video checks are different. The appointment needs to be confirmed by the staff beforehand. The doctor calls directly the patient from the computer, not from the iPhone. And then same policy in terms of how to fix the appointments. I don't know to what extent in this small video clip that we did for our network, you can understand how we use FaceTime. I will illustrate. Here we copy and paste from the clinical chart the phone number on FaceTime. This is FaceTime. You copy and paste the number. You then see that on the bottom you have video conference and you call. And now the patient appears on the screen of the computer. Now the glaring of the screen is very effective to illuminate the patient. So now the assistant is calling. Normally I do that directly. Instead of using spoons, you can use the normal fingers. So let me briefly speed up the process. I'm now instructing the patient, and now you can see it's a patient that has been operated 1 month ago. So we are checking the elastics. We show her exactly what we are looking at. And this is the way we normally look at the patient. So this is FaceTime. You can use the same system with Skype or Zoom. But to tell you the truth, probably the most convenient system is either WhatsApp with cellular telephone or FaceTime for those that have an Apple system. Here we are on Monday of the 2nd week, March the 2nd. And we had to deal also with the office reorganization and economics. So, very important aspect. After the proper training of staff, the staff sign a legal papers created by our legal office in order to get everything, let's say, properly recorded. That is also an important aspect of this very special situation. My staff has been absolutely fantastic. We have been now working with pros on team building and organization of the office. I can tell you, this is probably the best chance to team up with your staff. And it is unbelievable the reaction and the expertise that they can provide. So it's a great chance. I mean, every crisis has opportunities. This is one of the greatest. On Monday also, we evaluated all the records of patients scheduled for consultations. And the choice was made between the first and the beginning of the 2nd week. And what we decided was to select the consultations that had a very high percentage of acceptance. What I mean by that, we have above 95% of acceptance, mixed dentition treatment, very high percentage of acceptance of patients that have been fidelized because I treated sister or daughter. Situation where you expect a high percentage of acceptance. Then we decided for those that were able to do that to go in Skype or Zoom. And the amount of the feedback was amazing. First of all, because patients were very afraid to come to the office. And also we decided among the small number of patients and slot that we had available for patients coming to the office to go ahead and apply simple appliances that do not need any further office check. Palatal expander, for example, that we easily control in video checks. So in other words, we are considering also the cash flow that has to keep going. And so we had several patients recorded for a consultation in the following 3 to 4 weeks. And we selected those that could apply for Skype or Zoom consultations. Those were done using the normal Skype presentation or Zoom, the same that we are doing today. And it has been absolutely fantastic. So 20 accepted, and we did also video re-evaluation of treatment that had been scheduled. We did not postpone them because then when we will reopen, very likely we will be under extreme pressure. So we want them out of the way, and they were extremely effective. So Skype or Zoom can be excellent way of doing video consultation, and the feedback of the patient has been absolutely incredible. All the normal checks of patient that have not yet started treatment, we are talking about hundreds of patients, of course, that are the main source of future starts. We maintain them on a normal schedule, but we check them on video checks. So all of them have been maintained. The feedback totally exceeded their expectation. So even though this is not a marketing tool, but is becoming the best marketing tool that we have tried so far, because the reputation of the office really will increase significantly. First of all, we are not pretending to monitor and take records and monitor every step of treatment. We do that, and we can demonstrate that we have pictures, x-rays of any details that we are doing. That is, if at the beginning price might be more important, at this point they do appreciate the difference among other dental offices that do not have anything like that. So keep that in mind. This is also a great opportunity. So we also are activating PayPal and credit card e-commerce payment, that digital payment. Of course, we have been using wire transfer, any type of electronic payment in the past, but we didn't have the possibility for a person at a distance to pay with a credit card like in e-commerce. Now we activated that. Is a little bit more expensive than normal credit card payment, but we want to maintain proper cash flow. That is extremely important. And therefore we kept sending SMS remembering the due payments. And so far they are respecting, let's say in the vast majority are respecting the due payment, despite the moment that is very scary for all of them. The response is good. Now we are at the last week, Monday, March 9th. Since 10 days, we were on the red zone. But when you're in the red zone means that we have several infections every day in our area, but it increased in an exponential way. So we decided to reduce the flow to 8 patients per day. but we increased the flow of 30 video checks per day. And it takes time, believe me. The patient that we see, that we saw, were patients that, of course, we could not reprogram. And of course, those patients are seen by 4 people, 2 doctors and 2 staff in full gears. So, and in only on 2 chairs, limiting to a minimum everything that we do. We have done about 4 Skypes per day, consultation per day. And we sent about 50 DHL or May deliveries per day related to aligners, retractors, elastics, wax. Then Friday, 2 days ago, by indication of the health authorities of our area, we closed the office to patient. Keep in mind that the last week we saw only 8 patients per day, but we ended on Thursday. On Friday, we closed the office to patient. And we used the last days to organize 4 computers for staff that could work in smart working from their houses. They are all connected to the servers of the office. They have full access to the schedule and the charting of the patient. And so they can alternate every day. 2 of them, they will be employed in these video checks or anything that is necessary, using 4 cellular telephones. And in the office that is closed, we will have from Monday through Wednesday 2 staff, 1 IT person. IT is Andrea, that is actually helping us at the moment to run the platform, and 1 clinical staff working on the phone and directing the eventually emergencies, small emergencies on the phone. But the office is closed to patient. And starting tomorrow, we have 40 video checks per day. So this is more or less what we have done in the last 3 weeks. The situation in Parma is not as bad as in the northern part of Milan area and Bergamo, where the system is, health system is extremely under pressure. But is, we are expecting the peak within the next 2 weeks. So it's not yet get to the peak of the situation. So that's what they said, but I don't want to play the expert at this point. I'm simply saying, just to share facts, that the assumption that it will affect only people after age 80 might not be the proper assumption. So I'm simply saying, be very careful. And I talk by experience. I already told to some of you, Andrea, a person that I know since high school, 59, apparently in good health, passed away 2 days ago. We have been playing soccer together for 30 years. And so that was 2 days ago, after 5 weeks in emergency room. And this morning, a second one of the same team is in emergency room, and we hope the best for him. So I don't want to appear tragic at the moment. I think our spirit has to be high, but it's a serious matter, and we should treat it as a crisis. And the crisis is a time of decisions. So there are threats and opportunity, and threats has to be understood, because I think it's very important at this point, at least in my perspective, to be proactive versus being inactive. Also, self-deception is much worse than knowledge. I have seen so many colleagues saying, oh, it's not something that will happen to us. And they've been working on normal patient, like if anything didn't happen since probably the beginning of last week. That was absolutely crazy. And the authority, since we are a medical profession, were saying, it's up to you, up to the point where about a week ago, in the red zone, they start to say, you should close your practice and just guarantee emergencies. So self-deception is not what we need, because with self-deception, very likely we go into panic instead of proper reaction and finding the proper solution. And finally, I would say that is much better to be together than alone. And so that's the reason why we are continuously sharing solution among our network. And it has been extremely, let's say, important. Also, because from, let's say, a psychological standpoint, at least I speak for myself, to be aware that we are doing the best that we can gives us satisfaction, and satisfaction is the best source of energy. Inaction brings depression, and you lose lots of energy. So one of the rules in our that I put in our WhatsApp is we should post only solutions to the problems, not complaints, because that doesn't bring anything to us. So there is not, I mean, of course, we're doing many other things. Some professional tutorial will be created. And of course, through Eva, I make them available to all of you if you are interested. This is what I have to share. I hope that it was good enough. And now we can have a chat line so that if there is, and I'm sorry about that, I made the same mistake. Let me start again. Andrea, posso ritornare sul mio video?
Sì, Renato, non occorre che fai lo screen share. Adesso se dovete fare domande puoi staccare come vuoi.
Ok, però io non vedo la chat line, me la fai vedere per cortesia?
Ci conviene staccare lo screen share, così vedi tutto, tanto non ti servirà più. Immagino.
Faccio questo, devo staccare, stop share, giusto?
Esatto, così vedi
Perfetto,
tutto
però
e tutti.
non vedo la chat line.
Ce l'hai nell'altro schermo, forse?
Vediamo. Ok.
No, vai verso il basso.
Come?
Vai verso il basso. In basso c'è la barra.
Ok, perfetto. Ok.
Non ci sono domande, comunque.
Ok, if there is any question, you can use the chat line. Okay, apparently there are no questions. So, well,
I have one. I'm writing, but very slow.
No, you can talk. Everybody can hear you now.
Hi, this is Ahu. Renato, thank you for this very valuable, informative presentation. I'm just asking that protective gear that you have been wearing, is it a disposable one? I mean, do you change it after every patient?
Okay, let me bring back. I ordered them through Amazon, and those are 3M gears for chemical workers. And normally you are supposed to wear them without touching, of course, with your hands the whole day. And after that, cautiously, you need to keep your gloves and mask on, take it out, reversing it, and then put it in the disposable, we have special, special places to put this type of rubber. rubbish. And so it's, let's say, infection type of disposable devices. But we change at the end of the day that, and also the mask. The mask we will not take it out.
Was there any occasion where you had to use these earpieces with, and did you ever have to create some aerosol, and did you have to take any precautions for that?
Well, you can use high volume, suction, but actually we decided not to take chances, and we haven't used hand pieces since almost 3 weeks now.
Okay, thank you very much.
Renato, can you hear me? This is Manuel.
Yeah, Manuel, I can hear you very clearly.
Thank you so much. This was amazing. What is the manufacturer of these face shields you use?
Okay, you have two type of face shields. You can use again goggles that are sold to chemical workers. Those the wife of my brother is directing the triage of the infection department at our hospital. And so she told me that it's the same that they are using. Those are goggles, I mean, like the one that you use
goggles.
for dive. Goggles, sorry about that.
Goggles.
And these can be used, or you can use shields. I mean, those shields you can find it easily on Harry Shine catalogs. The only issue that we have that they are difficult to find at this point in Italy. Okay. Germany.
Do you reuse them, Renato?
Okay, that depends on the one that you bought. Normally, we use the same type of alcoholic solution to clean them, and you have to clean them with gloves on. And the suggestion for all the staff, never to take out gloves. If they use a sanitary gel, they should use it on gloves or new gloves. And so always, I mean, the touching is the most difficult part, but we normally sanitize them, and we define a special area in the office where only if they are disinfected, you can put them on a desk, on a, how you call it? Yes, a desk that was properly kept for that purpose.
Okay, thank you so much.
Okay.
Renata,
yes.
Can you hear me? It's Neville.
Hi, Neville, how are you?
Hi, well, thank you very much for that. That was really, really instructive. I just wondered, what were the legal documents you got the staff to sign?
Well, I don't have any problem to send to Eva, but it's in Italian, unfortunately. Basically, yeah. It's a document that confirms that you gave all your staff the relevant information to practice within such condition, so that they know exactly what are the problems and how to handle disinfection, the contact with the patient, and stuff like that. Also, keeping the distance among the staff, 2 meters of distance, and all the different aspects that are relevant of this. I mean, the policy of how you work in the office, and they confirm that they got this type of proper information.
Very good. Thank you so much.
Renato,
yes.
Can you just put this document under Google Translation, which will translate immediately from Italian into English, and just check if more or less this is okay? How about this?
Well, what if I send you the documents?
I mean, I can do it the same because I don't read Italian, but okay,
yes,
I can just
send you the 3 documents, and let me double check. How can I say it? Well, the only issue is it's the legal firm that takes care of the network of our network of 85 yes. offices, and she works for us. I don't have any problem to send it to you, but let's use it as a confidential document that you will adapt to your need.
Okay, just send me in Italian and I will just translate by Google.
Okay, but
Or
formally you haven't received anything from me, right? I mean, it's an emergency, so let's face it.
No, I understand it perfectly.
Okay.
Renato, one more question. Has any of your staff got infected?
No, actually, that is also a very important question because the policy, of course, is valid also for the staff. So what happened, first of all my staff did not blink when I asked them to come to the office and work full time. I mean, believe me, the first week was almost a nightmare. We had to work like animals to create everything and to make it work. But unfortunately, one of them, the husband, works with one person that got infected. She didn't have any problem. He didn't have any problem, nor she still has a problem. That happened more than 2 weeks ago. But I forced her to stay home. The second, again, the husband got a fever, normal seasonal fever, and she got fever as well. And I asked them to stay home. After a week, they asked me to come back to the office, and I told them not to. Then there is another issue, is how we are going to deal with wages. Now, of course, you can imagine the economic stress of the country at this point. So at this point, they are using, they have about 32 days of holidays. So they are using the holidays they haven't done before, or they use because they are turning now, or they are using permissions because they have young kids. Possibly they are saying that the state will cover part of the expenses for them. So, but so far everything got the same wages, no let's say significant issues on that side. That is very important so that they feel secure also from that point. I mean, staff is essential, and my staff has been one of the best that I can ever desire. Any other question? Well, if nobody has questions, then it's time to leave. And I wish you, all of you, the best. And I hope that it was useful somehow. Thank you very much for your time and have a good night. Ciao.
Thank you, Renato.
Thank you so much, Renato.
Thank you.
Thank you.
Take care, everyone.
Renato.
Take care.
That was wonderful.
Thank you, Renato.
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 Fantastic.
Thank you very
Good luck.
much.
Fantastic.
Thank you, Renato.
Grazie.
Take care.
Bye-bye. Thank you.
Bye.
Bye.
Big hug.
Bye.
Bye, everybody.
Bye.
Bye-bye.
Bye-bye.
Bye.
Bye-bye. Bye-bye.
Bye.
Ciao Renato. Grazie.
Ciao a tutti. Ciao Gisli.
Ciao Renato. Ciao Renato caro.
Ciao, ciao.
Ciao, ciao, grazie, è veramente utile, grazie, sai.
Grazie.
Ciao.
Thank you, Renato. Take care.
Thank you, cari.
Grazie mille Renato. Fantastico.
Grazie Lore. Ciao.
Ciao, Renato.
Ciao.
Ciao, and thank you. Thank you, Renato.
Ciao Karin.
Take care.
Andrea, ci sei?
Bye, Renato, again. Thank you. Thank you so much.
Thank you, Mauro.
Bye.
Bye.
Sì, Renato, ci sono.
Ciao, Renato. Thank you very much. Bye-bye.
Bye. Was it Claudia? Was it easy to follow or?
Very easy to follow as always. Thank you very much.
Okay, ciao.
Ciao.
Ciao Renato, grazie. Grazie. Ciao.